Welcome to the JCIH podcast, Health and Communication Distilled, a podcast of the Journal of Communication in Healthcare, Strategies, Media, and Engagement in Global Health. Each 10-minute episode features conversations with our authors on translating their research findings into practical and policy recommendations that will ultimately improve patient, community, and population health outcomes.
Welcome to a new episode of the JCIH podcast, Health and Communication Distilled, a podcast series from the Journal of Communication in Healthcare, Strategy, Media, and Engagement in Global Health. My name is Gloria Zucchini. I'm the current Communication Technology and Social Media intern for the journal. Today we have with us our author, Joseph Smizer, and we will be discussing his research quantifying the rise of vaccine opposition on Twitter during the COVID-19 pandemic, published online in December 2020. Hello, Dr. Smizer, and thank you so much for taking the time to be here with us today. Would you like to introduce yourself before we start?
Sure, and thanks very much for having me. It's always fun to talk about a research article. You never know if anybody really reads them. So it's great that somebody's interested. So my background is I'm in public health. That's my PhD and my master's are both in public health. And within public health, I specialize in health communication. And a lot of my work over the years has been on social network analysis or basically various ways of looking at public media data for public health. So disease surveillance, tracking misinformation, things of that nature.
Would you please start by summarizing your study, including the results?
We had access to 100% of Twitter data, which is pretty unique in the research world. Most research papers that you read that analyze some facet of Twitter that are university-based research studies have access to 10% or less of Twitter data. But in our case, we had the full fire hose, which means 100%, including all the metadata that comes with that. And we looked at all references to vaccines. 4 months before the US became aware of COVID-19, once it became aware that it was within the borders of the US. And that was October to February. And then we looked at a second time period, which was February to June 2020. And we examined if there was a shift in conversation themes about vaccines prior to the public being aware of the pandemic, and then 4 months after the public became aware of the pandemic. And we were looking for shifts in that conversation, and we were particularly interested in references to opposition to vaccines. And we categorized the themes of that conversation opposed to vaccines before the pandemic and during the pandemic. And we were looking for, did those themes shift during that time period, the before period and the during period? And we did find the conversation shifted quite a bit. So not only was there more vaccine opposition on Twitter than there was previously, but there were also changes in the proportion of the themes over time.
One thing that I found really impressive is the increasing number of unique users after the pandemic onset in US engaging in conversation about vaccine opposition on Twitter. And this number increased by 174.8%. That's huge. So what's the main cause of this engagement and why with the pandemic in particular?
Well, it's important to mention that we focused particularly on conversation that was opposed to vaccines, not tweets that were vaccine hesitant. And we had a way to differentiate between tweets that were hesitant about vaccines or asking questions or were engaged in an honest debate about vaccines versus tweets that were clearly, anti-vaccine tweets that were on the far end of the spectrum of hesitancy to where they were just direct, 100% opposed. So with that in mind, what we found was there was a huge surge of interest in the public, of course, in vaccines during this time driven by the pandemic. But if you're looking at accounts that were incentivized for their own reasons to be opposed to COVID-19 vaccines in particular, what we saw happening was this confluence of different sorts of actors. So whereas anti-vaccine advocates were well known to those of us who study vaccine conversations prior to the pandemic, those people and organizations were still around during the second study period. But what we saw were a lot more organizations and a lot more people that previously hadn't been too involved. They wouldn't have labeled themselves as anti-vaxxers necessarily, but they all jumped onto the anti-vax bandwagon and started also parroting the same talking points. So we had anti-government organizations, we had conspiracy theorists, we had white nationalists, all these different types of people and organizations that for their own reasons decided to use vaccines as a way to motivate and galvanize their own particular following, the audiences that they were trying to reach. And it all adds up together into this much larger, much more nuanced, much broader anti-vaccine movement now than existed in 2019 and earlier.
You found 11 themes that emerged from conversations on Twitter in the period between October 2019 and February 2020. And the one that became more prominent and received most mentions over time seems to be the conversation around federal health agencies, such as the Center for Disease Control and Prevention, Food and Drug Administration, or leaders of health organizations. And this made me think about the impact that these kinds of conversation on a privately owned platform like Twitter have on the public space and opinion. And I wonder if it's possible to monitor or control these online narrative frames.
It's completely possible to monitor it. So we have a system that was funded by New York State Health Foundation. It's run by the organization that I lead called the Public Good Projects, or PGP. And that system had been active monitoring in public media data, not just Twitter, but across all social media and all public media. So these are public conversations across a range of sources, references in opposition to vaccines. We had started that project in 2019 because there were measles outbreaks all over the US. So this was before the pandemic. And at the time, everybody in public health was concerned about these measles outbreaks because other researchers had determined they were fueled by misinformation. So this was a trend that had already been occurring. What we found in this study was the pandemic and the infodemic caused by the pandemic accelerated this and grew it exponentially. So anything the government did, anything the US government did in particular that related to vaccines, any announcement about vaccines, any new research, any new studies that were shared, anything shared by the CDC was capitalized on and leveraged by vaccine opponents. So they needed a boogeyman to mobilize their digital army and the people who show up for anti-vaccine marches and show up to school boards and community meetings. They needed a boogeyman, a villain, to have those people focus on. And you can't focus on a virus, but you can focus on a government. So what they found was, whenever they focused on the US government or public health authorities, public health leaders like Dr. Fauci, that was a sticky talking point. The vaccine opponents liked that there was a villain with a face. And so they doubled down on that, and that has continued to this day. And what we found is there is much more widespread distrust of the CDC, of public health in general now than ever before since we've been conducting this research. So the problem is much, much worse now than it was in the past. And I think one of the things that anti-vaxxers have discovered is you can significantly damage perception of a public health intervention like vaccines if you focus on the researcher who was responsible for leading the team that created the vaccine.
Thanks, Joe, for this perspective. We know that vaccines are a controversial topic, and it's difficult to pinpoint and categorize individuals' belief. Many individuals are less likely to gravitate towards extreme positions, but still may experience hesitation and doubt. So, referring to your paper, some have argued that vaccine opposition should be addressed by focusing on those who are vaccine hesitant and not on those who are strongly against. What do you think about this approach?
I think things are really bad right now, and I don't feel optimistic, particularly in the US. So I think the anti-vaccine movement went from being a fringe movement to now a mainstream one. So the problem is now ubiquitous and it's infected our whole society, particularly here in the US, although globally also. So it's extremely concerning. And I think the only way that we can push back on it is a whole of society approach. My personal view is I have seen no evidence that public health should engage with vaccine opponents in any kind of major way because it fuels the opposition. It doesn't put out the fire, it makes the fire bigger. They love when they're confronted because that gives them more attention. I think the better move for public health is to focus on people who have understandable, very legitimate concerns about vaccines and particularly new vaccines, and to meet them where they're at, to respond with empathy, and to do the job of public health, explain things in a way that people can understand and meet people where they are. All that needs to continue. That being said, we have a huge problem that only appears to be getting worse. And I think this is a problem that's going to be around for a really long time. It's already damaged the CDC's reputation almost irreparably. And so we need other means of figuring out what we do as a society with clearly anti-vaccine opponents, people who are they're not hesitant, they're against it. They're against all vaccines or against COVID-19 vaccines for no good reason. What do we do about these people and organizations while protecting free speech? Those are massive questions that are bigger than me, but I can say from our perspective, looking at the data every single day, we're doing very little to address this in any kind of meaningful way.
And why did you choose to study Twitter instead of Facebook, for example, or other influential networks that also have a lot of followers among communities?
Well, Twitter gets a bum rap. And if you look at peer-reviewed studies that use public media data to test out different sorts of public health hypotheses, it's skewed. There's a bias in the research, and there's a simple reason for that bias. Twitter actually makes its data available free of charge to researchers at universities and at other research organizations. The other social media companies don't do that. So you see more studies on Twitter than you see on Facebook or TikTok or other platforms, because those platforms don't give their data to researchers in a way that allows them to perform analysis. So you'll see lots of studies on Twitter. It doesn't mean that Twitter is the most important social media site or that it impacts society more than other social media companies or social media sites.
Great. And last question for you. What are the potential future directions for this kind of research, and what would you like to see implemented?
I think what's going to happen, and you already see it happening, is there's a new field within public health, and it's called social listening. And that means media monitoring plus signals that you're getting from surveys and pulse surveys and community surveys, word of mouth. All that comes in and you call it social listening. So there's an offline and an online component to it. What we're seeing in governments all across the world at the national level and at the local level, like in a public health department, are teams being built with team members called infodemic managers, for example. And they are attempting to very quickly learn how to do this work and to operationalize it, to fit it into the daily work of public health, and to figure out in that process, okay, I found something. Now what do I do with it? Who do I inform? What do they do with it once they're informed? That's where we're at today. But what needs to happen is, because it's a massive game of catch up, there's no standardization. There's no standard operating procedures. There's no best practices. Whereas in the PR world, they already have those. They already know how to do this. There already are standards and norms. In public health, there aren't. So you've got the WHO out there releasing thought pieces pretty regularly. You have academic research institutions doing the same, but it's kind of the Wild West right now. One health department has a team and is doing it totally differently than another health department. And so I think in the next 2 years, you're going to see people who go and get an MPH in epidemiology being able to specialize in social listening. And that's wildly different than what public health was doing 2 years ago. So it's exciting in that sense. There's a lot of change coming, and I think it'll be a really interesting, a much more interesting field for people who are entering into public health now.
Thank you. Thank you very much, Joe, for your valuable insights and for being here with us today.
Yeah, of course. Thank you.
Thanks for listening to the JCIH podcast, Health and Communication Distilled, a podcast of the Journal of Communication in Healthcare, Strategies, Media, and Engagement in Global Health. Follow the journal on Twitter at JCIH Online for news about the articles we publish and other resources. That's JCIH Online on Twitter.